Napaka-importante yung convergence and tourism initiative na ito, which is a partnership between the Department of Tourism, Department of Health, and TIEZA, because it conveys to the world that tourist safety is our priority here in the Philippines, where we ensure that as our tourists enjoy our island destinations, we are also taking care of them should they encounter any illnesses, emergencies, or accidents. And we are pleased to engage the Department of Health, their expertise in providing medical personnel, as TIEZA provides the tourism infrastructure funding. So this will be a first for Philippine tourism, and we will roll this out in key destinations all over the country.
So this idea was when Secretary Frasco approached me, they already had the design and the facility in continuation of a rest area, di ba? The tourism rest area, and the next step was a tourist first aid. Of course, me being an emergency doctor, you don't have to sell me that idea because I know many stories of tourists that got into either head injury or nabalian ng buto. You hear this, even local tourists, di ba? And we have nowhere to go in this very nice island destination. So when she broached the idea to me, oo kaagad ako dyan, and we will provide the personnel. So bali, ang tie-up is CHESA is building the facility. We will be providing the human resources for help, the doctors and the nurses. I think I will have no problem with doctors wanting to stay in this destination island. Yeah, assign ko siya doon. Baka magkagawan pa sila.
Second, follow up lang po regarding the facilities. How
Yes.
many medical personnel are we planning to deploy to each?
Ito, easily 2 or 3 personnel, no? 1 doctor, 1 nurse, and probably another assistant to the 2 of them. We will provide, as you said, ang emergency care meron kami tinatawag na links in the chain of survival. Kung may break ka sa kadena, hindi ka abot. Like what's happening, they're not identified in the resort facility, di ba? Nadi-delay yung care nila. Here, by having a doctor and a first aid, they will be able to do something, kahit little, to actually activate an emergency response. So, hindi naman doon gagamutin yun eh. Usually in another facility, maybe in the mainland, para madadala siya kaagad. So, this is the key in emergency, yung immediate action. Yung usually, yung delay in most of our stories, horror stories of tourists, matagal bago sila nagamot, matagal bago nakahanap ng sasakyan, matagal bago na-airlift dun sa hospital. We have good hospitals in the cities, but not in the island destination. So, ma-identify lang sila. So, the first step of the doctors is to triage, yung pa-prioritize nila, alin ba ang life-threatening, not life-threatening. Pag life-threatening, ililipad na yun or ililipat na yun by boat to the next facility.